Hi, today I'm Chad, this is Tammy. Today we're going to be doing a thoracic and skin or integumentary assessment on our patient Judy. We've already performed our hand hygiene and we've done our toe identifiers. So first of all, we're going to inspect the anterior chest, looking for rates of respiration and effort of breathing, keeping a close eye on shallow or rapid expiration and inspiration. We're also going to be checking the intercostal muscle use. So go ahead and just breathe regularly, Judy. That's great. Now Tammy's going to go on and do the palpation of the chest.
Yeah, so basically what we're going to do is we're going to be palpating your chest here, Judy. The reason we do this is we're going to be looking for any tactile phragmatist, which would be subcutaneous air trapping. So I'm just going to use the palms of my hand. And as I'm palpating here, Judy, I'm also going to be double checking for any tenderness or any lumps that you may have in here. So, good.
If the female does have a lot of breast tissue, you can actually ask her to lift the breast tissue so you can just feel underneath.
Exactly. I'm going to actually then move on to using the palmar aspect of my hand here, Judy, and I'm going to be placing it into your intercostal spaces of your ribs here. And what I need you to do is each time my hand touches you, I'm going to have you repeat the numbers 99 to me. We would do this laterally to ensure that it was symmetrical on either side as we're listening to the vibration. So I'm going to have Chad do one side for me as well. So go ahead, Judy, say 99. 99. 99 and 99. Excellent, wonderful.
Okay, so now we're going to auscultate the anterior chest. We're going to be using the diaphragm of our stethoscope. We will be going side to side laterally, so I'll have Tammy do the other side while I do my side. We're going to be doing the upper chest, mid-chest, and under the breast. We're listening for adventitious sounds, wheezes, crackles, or rhonchi, and hopefully she's good.
And Judy, each time our stethoscope touches your chest, could I have you take in a deep breath, please?
That's great. So if she did have any consolidation, we would hear the wheezes and the crackles. Wheezes kind of sound like rubbing, they're more of in asthmatics.
Yes, exactly.
On inspiration, and crackles are more of a hair rub, and rhonchi is more of a harsh, and it would be deeper in the chest for consolidation. It could indicate possibly pneumonia as well.
And actually what we're going to do now, Judy, is we're going to turn her around. We're going to check her posterior lungs and chest, yes, and we're going to be actually listening for any of consolidation there as well. So. So the first thing we're going to do, Judy, is I'm going to have you inhale and exhale, and as she is doing that, I'm going to be watching the rise and the fall of her chest, and I'm going to be making sure that it's symmetrical on either sides with her intercostal muscles. Just push down a little bit. Okay, so everything looks great there. So Chad, did you want to go ahead? And he's going to do the test for inspiration and expiration.
So what we want to do is grasp the rib cage region and just push together a little bit of skin in between the spine. And I want you to inhale, and your fingers should move evenly with lungs that are both working properly and in. That's great.
Great. So next, Judy, what I'm going to do is we're going to be percussing your back here, and we're going to be listening for any resonance. Like I stated, any signs of your consolidation. So what I'm going to do is strike the joint of my finger, and we're going to be striking it in between each of our ribs into our intercostal spaces. And once you strike, you're going to release so that you're not dulling any of the sounds.
And normally we would go laterally.
Yes.
So we'll go across, down, across, down. So go ahead.
There, kind of a little dull.
Okay, great.
Wonderful.
So what we're listening for is resonance to dullness. Now what we're going to do is we're going to check for the diaphragmatic excursion. So that is the amount the diaphragm moves during inspiration and expiration. So we start from the bottom,
And what we're actually going to have her do
No, we'll
first.
start from the top.
Yes, we're going to have her start from the top. And Judy, when Chad's going to perform this on you, what I'd like for you to do is to take a nice deep breath in, and I'm going to get you to hold that breath, please.
Inhale. Okay, so right about here, and exhale. I want you to take an inhale, and now we're going to go from dullness to resonance. And when you exhale, I want you to hold it.
Yes, please.
Okay? So just about here, so her diaphragmatic excursion is it's usually around 2 to 6 centimeters, and it's the rise and fall, like I said, of the diaphragm with inspiration and expiration. And you would do both sides to mark because one lobe of the lungs is higher than the other.
Exactly. So next, we're going to run a few little tests on you, Judy. So what I'm going to get you to do is I'm going to ask you to repeat a few little phrases for me. And while you repeat those phrases, we're going to listen to your lungs. So
the first one we're going to do is called bronchophony, and what it is we want to hear a
99.
99.
So when you feel the stethoscope touching your back, can you repeat 99 for me, please? Now, with normal lung sounds, we should be able to hear that 99 very clearly.
If it was muffled, there would be some consolidation possibly in her lungs.
Exactly. We would also repeat those steps as well when we would do a whisper.
Yeah, whispered pictoriloquy.
Yeah, so what we would have her do is repeat, say 1, 2, 3, for instance. And by her repeating the 1, 2, 3, it's the same. It should be nice and clear. If we're hearing any type of muffles, once again, it'd be consolidation.
Actually, no, it wouldn't be clear. Oh, we're going to have a discussion.
Oh.
It wouldn't be clear. You wouldn't be able to hear it. If you did hear it, there would be a problem.
Yes.
Right.
Oh, did I say
So,
the
yes.
opposite? Sorry about
The
that.
other one is the agophony, which is the E sound.
Yes.
So you would listen for the E in the same areas. And if it sounds like A, that is an indication of consolidation. So go ahead.
Great.
All right. Awesome.
Excellent.
So we're done with thoracic assessment. What we're going to do now is move on to the skin. So we're just going to turn Judy around. We'll be back in a moment.
Okay, there we go.
Lock her down there.
Yes.
Hey, Judy,
Great.
I'm just going to lie you right back. There we go.
There.
All right. Great.
Wonderful.
Okay. So now we're going to do our integumentary assessment.
Now, our first stage that we're going to do here is we're going to have to do inspection. So we're going to do a complete inspection of Judy's skin. So we're going to first check for her color. We don't want to see anything that's like cyanotic, pale, or jaundice to her skin. So we're going to do a quick look over, make sure everything is good. Check down on the legs. We're just going to remove this down for now here, Judy. Wonderful.
So next we're going to check for any tracts or edema as
Yes.
well. So by tracts we mean if you're working on a patient that is possibly an IV drug user, you just want to make sure if there is tracts there that there is no infection.
Yes.
So yep, we're all good. Excellent.
We're also going to double check her moisture of the skin. We want the skin to be smooth, dry, and warm. So we want to make sure that it's not excess moisture here.
That's great.
And her temperature as well. When we're checking that, we can check her temperature to ensure that she has no fever, so it's not hot to the touch.
So right now we're actually going to move on to the scalp. So we're going to have a look at the condition of the scalp and the hair, and then we'll move from head to toe.
Yes.
So what we're checking for with the scalp is to make sure it's hard and smooth. Make sure there's no lumps or bumps, lesions under the hair.
Yes.
We're also going to be checking for lice, for hair distribution and texture.
Yes.
If there's any type of alopecia, And also, with the texture there, it could be a dietary factor involved. So
Yes,
yeah.
and also you want to double check too, if there's any type of dandruff in the hair that could signify that there was bursitis, or yes, psoriasis, bursitis. And also if it's dry and flaky, that could be dermatitis.
That's great. Okay, so now we're going to go down to the nails, and what we want to check here is a color. So it should be pink with good capillary refill. So within a couple of seconds, so we just press on the nail and release, and the blood should come back in. We will be checking for paleness or cyanosis in the nails.
Yes.
It could mean hypoxia or anemia as well. A yellow sign could be a fungal infection.
Exactly. Now we're going to check the toes as well. And while we're down here, we're also going to double check too to see if there's any edema pooling down in her feet. We're going to double check for any ecchymosis. We don't want any pooling of blood. So we're going to double check that while we're down here as well.
Great. Great.
Okay. And now also in her fingers, fingernails and her toenails, we're also going to be looking for vertical lines that we have. It's called the splinter hemorrhage. That shows some signs of trauma and also signs of infection.
That's great. And we will be looking for Bowes lines as well, those horizontal grooves, sometimes seen in acute trauma.
We're going to be checking for nail pitting. The nails that show signs of your psoriasis as well.
Nail clubbing as well. So the normal nail should actually read at about 160 degrees. If it's bigger than 160 up to 180 or more, could show signs of hypoxia, which is cardiac or pulmonary ailment.
Yeah, we're also going to look for any spooning of her nails. If there's any spooning, that's going to be indicative of iron deficiencies.
And thickening of the nail as well, which would show poor circulation. So.
We're also going to take a nice look at any of the bony prominences. So we'll check like your heels, your hips, your elbows, your shoulders, your back, your sacrum.
Both your malleolus, medial and lateral.
Yes, exactly. So we just want to ensure that there's no like pressure ulcers, any skin breakdown.
Yeah, and we've already done the back. We did inspect the back on our thoracic.
Yes, and we double checked as well to make sure that there was no freckles, no moles, no lesions, any lesions.
The good old ABCs: asymmetry, border, color, elevation, and diameter.
Yes.
So we want to make sure that they're all even. And we've also asked her if there is anything new that she's seen on her skin.
Yes.
If she's had any allergies as of late.
Exactly. We also double check to any of her history if she has been in contact with any communicable diseases such as chickenpox, mumps. We need to know any of that as well.
And we're basing a lot of our assessment on our vital signs, which we took as soon as we entered the room.
Yes.
We did take her blood pressure, her pulse, her temperature, and
respiration.
And her respiration.
Yeah, so everything great. So Judy, it looks to me like you have just passed your assessment. You've done wonderful.
And we'll be back later to do your perineal care and tuck you in. Okay.
Great. Thank you, Judy.